These symptoms you guys are seeing, irritation, pneumonitis, and non-gonococcal urethritis. It's not what I'm thinking it is.
But Dr. Hawks, we must consider all the possibilities. The patient has shown signs of irritation and pneumonitis. Could this be a form of...
I agree with Leslie. We can't jump to conclusions without considering all the data.
Yes, I'm thinking it's more likely to be a bacterial infection given.
Enough. You guys are just talking nonsense. It's Harlequin-type ichthyosis, all right.
But Dr. Hawks...
We need to consider all the information available.
What if we're wrong?
You're not wrong, you're just wrong for questioning me. And now it's time for a pancreatectomy. It's risky, yes, but it's what I believe is best for the patient. Now, let's do this. Good morning, Tracy. This patient has Harlequin-type ichthyosis and needs a pancreatectomy to save their life.
I understand that you believe this to be the case, Hawks, but you also have a track record of being wrong in your assessments. We need to discuss this further before moving forward.
You're questioning my years of experience again? I've performed countless operations and saved countless lives. This is different. You can trust me on this one.
I'm not saying that you don't have the skills necessary for your job, Hawks. However, it's important to remain open-minded about our approach when we're dealing with patients who are severely ill like this one.
You've been downplaying my expertise every step of the way, Tracy. I think it's time you stop and let me do my job.
I'm not downplaying anything, Hawks. All I'm asking is that we reevaluate our approach together before making a decision that could have serious implications for this patient. Let's discuss this like professionals, shall we?
Like professionals. Speak for yourself. I'm in a suit, tie, and jacket every day. Here you are wearing the same blouse for several months straight.
It was a darker red yesterday.
You're gaslighting me.
You wear the exact same clothes every day.
I'm a doctor. I have to look consistent or my patients might think I'm an imposter.
They already do. You never wear a white coat like real doctors do. You'd think that if you were going to act like a doctor, you'd at least dress like one.
I'm not a normal doctor.
Yeah, we've known that for a while.
The patient is in critical condition. I wasn't expecting that.
Because they're alive after a risky operation?
For once, you've read my mind correctly. Got any ideas?
We could call one of the better hospitals.
Yes.
Request an air ambulance helicopter from them.
Yes.
Have them fly over here.
Yes.
And take us for a ride so we can get jobs there while everyone else works on the patient here.
No.
What? This wouldn't help the patient?
What do you think, Frank? We're not solving the patient's problem, just our own. Also, how the hell do you expect them to hire us if we mention we work for Dr. Hawks at the future St. Duke Hospital?
We could apply for asylum.
Hospitals aren't countries.
Maybe we're sick. Maybe that's a side effect of us working here.
I don't think we can continue this conversation here,
Why not? We have to know what's going on with our patient.
because this is just stupid. My brain is rotting faster than the speed of light trying to get any sense out of you.
You morons nearly killed him. He had Harlequin ichthyosis, not what you thought it was. Pancreatectomy is not the treatment for that.
What do you think we should have diagnosed then?
I don't know, maybe he had a weird kind of skin disease?
We were doing our best.
Your best nearly ended his life. He had Harlequin ichthyosis.
To be fair, Hawks, I did suggest getting an air ambulance from another hospital.
Frank, that idea for the last time was stupid. You just wanted to joyride in a helicopter to another hospital in hopes of being hired there.
You shouldn't have stopped him, Randall. You would have solved the biggest problem I have with this team.
No, because the hospital would send him right back to us.
You're assuming Frank wouldn't attempt in vain to ask the pilots, "Hey, what does this button do?" and proceed to accidentally kill everyone on board.
I didn't think of that one.
No, of course not. You don't think at all, and the stupid patient is still in critical condition. Get out of my life while I figure your screw-ups myself! Hey man, just got some fresh intel on my patient. You know that weird illness they've been having?
Oh yeah, I thought it was just a bad case of food poisoning or something.
It's not, though. Not at all. It's actually... Oh, I see now.
What is it then, Hawks?
I figured out what the problem is. It's a rare condition that only affects a tiny percentage of people in their age group.
Wow, really? That sounds serious.
Yeah, it does. It's not something you can just cure with an antibiotic, though. They've got to go through the right treatment process.
Well, at least they'll get the help they need now. Good job on figuring that out.
Thanks, man. Appreciate it. Gotta go. I know I don't have proper protective gear on, but let's get to work.
Hawks, we can't ignore protocol just because you're excited about a diagnosis. You'll put yourself at risk.
And us, Hawks. We need to respect medical procedure, even if the case is exciting.
Can we please have some respect for our safety?
I'm not ignoring it, but I've got a patient that's been misdiagnosed. We're looking at focal dermal hypoplasia now.
Wow, that's serious. Fecal dermal hypoplasia is no laughing matter.
Team, don't talk to Frank for the rest of the day. I have the other hospital's helicopter en route.
Hawks, we've heard about focal dermal hypoplasia. It's not exactly a good prognosis, is it?
No, it isn't. But that doesn't mean we can give up. We'll take the necessary steps to manage it. Look, I made a mistake with that diagnosis here.
You sure did, Hawks. You admitted it yourself.
Right, but if my team had done their job properly, we wouldn't have needed to make the diagnosis in the first place.
That's not how it works, Hawks. We all make mistakes. The important thing is that you recognized yours and corrected it.
Mistakes. I've worked with more idiots than there are stars in this godforsaken universe.
Are you thinking doctors?
Yeah, that's what I said. And they're all idiots too, don't forget.
Hawks, if your team is so incompetent, why did you declare the wrong diagnosis yourself?
Because they told me to declare it.
And you'll listen to them?
What is it with you, Tracy? Do you want me listening to my other doctors or not?